I'm going to be demonstrating cleaning a wound. And so first, before I come into a patient's room, I want to make sure and perform hand hygiene. Okay. And I also want to make sure that they have enough privacy. And of course, goes without saying, I want to make sure this is the patient that's getting the wound dressing. I want to verify that, all of that. Okay, so after I made sure that she has privacy, everything's good, I'm going to gather the supplies. So I have my wound care tray, my biohazard bag, and gloves. Alright, so if there were going to be any sprays of any sort, you know, it's a pretty crazy wound, then I would want to put on a gown along with my gloves and everything, and goggles to avoid any risk there. So right now we're going to go ahead and start and put a cuffed biohazard bag near the patient where I can easily reach. Okay, and this is when I'll go ahead and apply my gloves. They're not sterile. They don't have to be sterile yet. Okay, and so I am going to make sure that the wound is exposed. And I'll also want to ask the patient to make sure and not touch the wound, touch the sterile field, anything. Okay, so I will first work by taking the tape on the outside off and move towards the inside of the bandage. Okay. And I will want to remove the top part separate from the bottom. And I want to make sure and do this gently because, you know, you don't know if it'll get stuck or, you know, what could happen. And this whole time I want to be assessing for any drainage, you know, before I have my actual assessment. Okay. So I have the outer dressing off, and it's really important to remember that, you know, people don't really like to see the amount of blood that they're showing or anything, so I'll make sure not to show the patient that, and I'll want to fold it up to control the drainage and put it in my biohazard bag. Okay, next I'm going to remove the one closest to the skin. Once again, not showing patient what's going on because everything's fine. Okay, and then I'm going to discard that. Okay, so then I will remove my gloves, put it in the biohazard bag, and perform hand hygiene. Okay, and then I'll want to apply new gloves. And at this point, this is when I want to inspect and assess everything. You know, see if there's any edema, exudate, how that skin integrity is looking, size, length, width, color, odor. Okay. Make sure, okay, see, all right, okay. Now I'll remove my gloves again. Perform hand hygiene again. Okay. And so at this point, I'm going to be setting up my sterile field. So this right here, this white, is the bedside table that I have put forward to easily access everything. So first I will bring over my wound care tray, which I need to open. So I will open that. Okay. First things first, I'm going to get a drape and put it right by the wound. Okay. All right, and then I will want to open the solution that I have here, and I will want to pour it on my gauze so I can clean the patient's wound. Okay, so that's going to be soaking. Okay, and now to get my sterile gloves. Dominant hand first, making sure I'm touching the inside of the glove, of course. Oh my gosh, that's the fastest I've ever done it. That's very exciting. Okay, putting it right in here on this cuff. Okay. Okay, now I have sterile gloves. I'm going to want to make sure that they stay sterile the whole time, and I don't ever put my gloves below my waist, anything like that. So my gauze has been soaking, so I'm going to go ahead and get my, you can use forceps. I'm choosing to use forceps. So I will go ahead and get the forceps, the gauze. And so it's important to, I'm going to do this just so the camera can see, okay? It's important to go from the area of least contaminated to most contaminated. So depending on the wound, if I want to do circular motions, if it's a drain, or if it's, you know, sutures, then I want to go, I want to do that, okay? So in between each swab, I want to throw it away and get a new swab. That was in the trash can because I'm getting a new swab each time, okay? Okay, all right, so go, that is clean, okay? So now I am going to get a gauze that is dry, and I'm going to blot the wound dry. Okay, throw that away. All right, and then I will. I'm going to show you how to do the moist to dry dressing, but I'll go ahead and explain what just the dry dressing is. I would apply a couple of sheets of loose gauze, and then on top of that apply a thicker pad, to which I would then tape perpendicular to the patient. So for this one, it's a moist to dry, so I would pour more sterile solution over the gauze, okay, let that soak, and then I would reapply sterile gloves because I definitely got rid of these. Okay, so sterile gloves. Once again, not touching the outside. Okay, beautiful. Oh, having really good luck with this today. Okay. Okay, so I've poured my my solution over my gauze that I did ungloved, which is really important to remember. Okay. Okay, and so now that that's been soaking, I'm going to wring the excess off of it. Okay, and then I'm going to apply the wet gauze to the patient. Okay, And if it's a deep wound, I'll want to pack it, making sure not to pack it too tight. But if need be, I'll apply another wet, depending on what the situation looks like. So I'll go ahead and put a dry gauze, apply a dry gauze on top of the wet one. Okay, and then I will get the Surgipad, which for the sake of this video, I'm going to make it this big so it actually fits on my patient's body. Okay, and then at this point, now that that's all covered, I would go ahead and remove, if I had any other like gown, anything like that, I would remove that. Go ahead and remove that PPE. Okay, so I'm going to remove that, remove the the sterile gloves, put it in the biohazard. I'm going to get my tape, making sure that I get it off of the tape dispenser before I apply it to the patient. Okay, and I want to do it perpendicular. To the patient. Okay. Okay, so now she is all good. So I'll want to go ahead and put on gloves after I've put on hand hygiene, of course, put on that hand hygiene. Okay, and then apply gloves, just regular gloves, because the wound is safe for myself. Okay, and so I will make sure and get rid of everything, making sure that if there was drainage, it stays inside. Okay. Remove this. Okay. Perform hand hygiene. Dispose of the biohazard in the appropriate receptacle area, and make sure everything's okay with the patient. How is your pain? Anything else you need? And that's it. That is cleaning a wound.